I am Cesar Keller, and I am the medical director of the lung transplant program. And I will be talking to you all regarding some issues that are very important for you to be aware regarding your oncoming lung transplantation. The general indications for lung transplantation involve a patient that is suffering from an end-stage lung disease. It has to be the kind of situation where it is known already that there is limited survival for this condition and that there is progressive disability. That's one of the general indications to think about lung transplantation. In addition to that, this condition has to be already known to be refractory to standard medical and or surgical therapy, meaning everything is being attempted and this condition is still progressing and is still limiting your ability to survive or is producing disability. In addition to these two important factors, there has to be no known contraindication to transplant. You may ask yourself, well, what are the usual contraindications for transplant? There are some contraindications that are very well defined. For instance, if you have chronic lung disease and you may need a transplant and you're still actively smoking, that will be a contraindication because the exposure to nicotine, either active or passive, will be very detrimental to any plan of transplantation. If the potential patient has drug and or alcohol dependence, a transplantation could not be considered under those circumstances. Certain infectious conditions such as active hepatitis B, active hepatitis C, and or active HIV will definitely be contraindications to transplant. If the patient is known to have active cancer or has been diagnosed with cancer in the previous 5 years, transplant cannot be considered. And the reason is because the medications that we will use may exacerbate a condition of a cancerous condition. Also, the nutritional status. If a patient has excessive body weight, and we go by the so-called body mass index, if you have a body mass index higher than 30, means there is too much weight in your body, and this will preclude transplantation. So patients that have excessive body weight, they will need to be able to reduce their weight close to ideal body weight in order to be considered for transplantation. Transplant is a situation that cannot be done by a person alone. Every patient that needs to consider transplant needs a reliable caregiver to walk that path along with the patient. If there is no caregiver, transplant cannot be considered. If the potential candidate for transplant will have active, untreatable cardiac, hepatic, or renal disease, this will also be contraindications for lung transplantation. So we make sure that a potential candidate for transplant does not have any of these conditions going on. What are the most common lung conditions that will be a consideration for a possible lung transplant? But the most common diseases are classified in 4 major groups: restrictive lung diseases, obstructive lung diseases, infectious lung diseases, and pulmonary vascular diseases. The most common indication for transplant today are restrictive lung diseases, which include conditions like idiopathic pulmonary fibrosis and or other fibrotic lung conditions. That's the #1 indication for transplant today. Then there are patients with obstructive lung diseases, and here COPD, emphysema, and similar conditions will be considered. Among infectious lung diseases, we have patients diagnosed with either cystic fibrosis or bronchiectasis. And in the group of pulmonary vascular diseases, you include all those conditions associated with pulmonary hypertension. Now, there are certain conditions outside these major indications that could be also considered for transplantations. But these 4 groups of lung diseases are the most common indications for transplant. When you come to our program, you will be given service by a transplant program that has been practicing transplantation for more than 12 years. We have evaluated more than 2,500 patients for possible transplantation. More than 600 of them have been listed for transplant, and as of today, more than 400 lung transplants have been performed in our institution. So you will be coming to a team that certainly has a lot of experience accumulated to take care of your condition. You will be seen by a large group of physicians and healthcare providers. But the core team of lung transplant will be characterized by the medical team. I am a member of such a team with my partners, Dr. Alvarez, Dr. Rasmus, and Dr. Malaya. There will be a surgical team that will also be available for your service, a core of nurse practitioners, lung transplant coordinators, and more support staff. In total, each one of these members of the transplant team will be at your service to try to facilitate this process. So you will not be walking this path alone. There will be a wide array of transplant professionals to assist you during this path. In addition to the core transplant team, likely is that you will be evaluated and or serviced by an array of other specialists. This includes psychiatrists, cardiologists, infectious disease doctors, endocrinologists, gastroenterologists, and others. You will also be assisted by social services, finance services, pulmonary rehabilitation services, and nutritional services. So a very multidisciplinary approach is the one that has worked the best to manage patients with the need of a lung transplant. You will come to know that your initial evaluation will be quite comprehensive, and we will talk more about this in a subsequent lecture. But for now, suffice to say that when a patient is evaluated, the initial evaluation will give us three potential options. Option one is that after reviewing your case and your medical records, you are considered a very likely candidate for lung transplantation. You will then be asked to ask a specific consent form to be evaluated, and then you will be scheduled for evaluation. That's option number one. The potential second option is that after reviewing your case, your history, and your medical records, there is an obvious contraindication to proceed with lung transplant. We will therefore consider alternatives of care that could be offered for your condition. And a third potential path is that after you learn everything there is to know about lung transplant, you may decide that you may not be so sure about lung transplantation. And if that is the case, then we will provide you with all the information we can to assist you on making this decision. And likely is that we will refer you to our very well organized lung transplant support group, which is composed of various members in the community that have been either transplant recipients and or caregivers and or friends of the lung transplant program. And they have a lot of experience and a lot of opportunity to assist you in the decision-making process. When you learn about lung transplantation, initially things may appear overwhelming. However, as overwhelming as this may be, certainly this is a path that many patients have walked before. As mentioned earlier, you will need a very reliable, supportive, enthusiastic caregiver, the one that can make you help you soar at levels that you have not been before. If you do not have this component in your application for lung transplant, then the path will be difficult. So you do need indeed a very reliable caregiver. You will find yourself that you will need a very positive attitude to face transplantation. If you focus your mind on all the things that could potentially go wrong with transplantation, you could make your life really miserable. But transplantation offers also the miraculous recovery from an otherwise relentless end-stage lung disease. And if you focus your energy on all the positive outcomes that are conceivable after transplantation, you will have a much better opportunity that your transplant indeed will be successful. As overwhelming as it may appear, this is a path that hundreds of patients, and by now thousands of patients across the country, have walked before with very acceptable levels of success. And this is something that you can do, and we will help you in this path. So, as a preliminary introduction to what lung transplantation is all about, this is what I had to discuss for now. Thank you. Hi, I am Dr. Cesar Keller, and I am the Medical Director of the Lung Transplant Program at the Mayo Clinic, Florida. In the next few minutes, I will be reviewing for you the process of the evaluation for lung transplant all the way until you get listed and called for transplantation. When your lung transplant evaluation is scheduled, we want to learn how bad your lung condition is, because we need to demonstrate that your condition requires a lung transplant. But also, more importantly, we want to learn how good is the rest of your health. How good are your other organs functioning, your heart, your brain, your muscles, your bones, your kidney? Because all those patients that have extremely bad lung condition, but this is associated with extremely good function of all other organs, are the ones that will have the best prognosis. So the evaluation is quite comprehensive. The evaluation will include a full cardiopulmonary set of testings, and this will involve tests that maybe you are already familiar as lung transplant patients, such as pulmonary function test, an array of chest x-rays, radiographs, CAT scans, lung scans. It will involve also exercise tests, walking tests, and measurement of your arterial blood gases. In addition to that, we need to do an extremely detailed evaluation of your cardiac function. Our patients will undergo right heart catheterization, which involves to place a catheter through the jugular vein in the neck into the pulmonary arteries with the purpose of measure the pressures in your right heart and in your lungs. You will also be subjected to a left heart catheterization done by a cardiologist, and the purpose of this test is going to learn not just how good your heart functions, but also what's the health status of your coronary arteries. Other systems that will need to be evaluated will include a detailed gastrointestinal evaluation, and you may think that GI system may not be related to the need of lung transplant, but indeed there is a close correlation. We need to make sure that you do not have any condition in your GI system that could complicate a lung transplant, such as reflux or gastritis or esophagitis or others. We also need to make sure that your lower intestinal system is healthy. So our patients will likely undergo a variety of radiographic studies to assess the esophagus and the stomach. They may need an endoscopy if indicated, and all our patients will undergo a colonoscopy to make sure that there is not an underlying disease in your colon or an occult cancer or polyp that may need to be taken care of prior lung transplantation. Also, for females, cancer screening will include mammograms in addition to the colonoscopy, and for males, we will assess prostatic function and making sure that there is no evidence of an underlying prostatic cancer. We do a detailed evaluation of your bone condition, and we are particularly interested in making sure that you do not have significant osteoporosis or any other condition that could predispose to bone fractures. You will have to undergo a psychosocial evaluation, which will involve sitting down with a psychiatrist, a psychologist, and also social workers, and in which we will be assessing your mental health condition in the context of a possible lung transplantation. And you will have a very comprehensive blood work studies done in order to assess many situations that are pertinent to transplantations, not the least of them what's your blood type, and whether if you may or may not have antibodies that may contraindicate transplantation. Once you have undergone all this comprehensive evaluation, once every specialist that needs to see you has had the opportunity to meet your case and render an opinion, then on a weekly basis, every lung transplant program, including ours, has a process in which all cases that have been evaluated for transplant undergo discussion. This is called selection conference. And this is a multidisciplinary team composed by all the lung transplant physicians, heart transplant physicians, surgeons, psychiatrists, infectologists, nurses, coordinators, etc. And every patient that has completed the phase of evaluation will be discussed. And the reason for this discussion is to see if the Mayo Clinic lung transplant team feels that there is indeed an indication for transplant and that there is a reasonable expectation that the outcome will be favorable. Also, in this meeting is decided whether if the type of transplant that needs to be done is a heart and lung transplant or a double lung transplant or a single lung transplant. All these decisions are made. Once we accept a case for lung transplantation, then we submit an application on the behalf of this patient to the United Network for Organ Sharing. It's called UNOS. This is the institution that has to bless the decision of the Lung Transplant Center, and this is the organization that actually places the patients into the National Transplant List, and this is the group that will assign to every patient placed on the lung transplant list a so-called lung allocation score. And this is a score that is given to every patient based on the results of the evaluation. The idea is that the sicker the patient is at the time of need, the higher the lung allocation score will be, and vice versa. Therefore, those patients that are the sickest ones will be the ones that have higher score, i.e. they will have the shorter waiting times. So the whole process involves, first, a transplant center that evaluates and accepts a patient for transplantation. When this case is accepted for transplant, then a petition is made to UNOS in order to place your case into the National Lung Transplant List. And this organization will assign you a score of necessity called lung allocation score, and then comes the waiting time. This is the time that you will be listed and then waiting for the opportunity that a suitable, compatible donor is made available for your transplant. During this waiting time, we will be trying to use that time to make your condition as good as possible, to make you as strong as possible, so you can be ready for the day of transplant. When a donor becomes available, typically this will be a healthy person that has been declared brain dead for any kind of catastrophic condition to the brain, and likely is that that donor will not be at our center. Chances are it's going to be at another center. When such donor becomes available, then the local organ procurement organization called OPO will be evaluating this patient. They work with UNOS, and if the patient is considered to be a viable candidate for donation, they become involved in the management and evaluation of this donor. And based on the lung allocation score, if the organs are found to be healthy, then they will be making the offering to every transplant center as is indicated. So when there is a donor compatible for you, it will be the OPO who will be calling us to let us know that a compatible organ has been made available for your transplant. We will receive the information over the phone, and we will decide if the organ is indeed acceptable for your case. When this situation is acceptable, that's when you will be called to come to our center in order to proceed with your lung transplantation. Let's talk a little bit about this waiting time and what to do about. Things that we know based on multiple studies is that the outcome of lung transplant will be largely affected by your nutritional status. If you are undernourished, malnourished, with extreme loss of healthy body weight, you will not have a good outcome. And equally can be said by those patients that have excessive body weight. Therefore, it's being known that patients that had a body mass index under 17, which is usually consistent with malnutrition, the outcomes will be poor. Same can be said for those patients that are overweight or obese. So therefore, during your waiting time, if you have too much body weight or too little body weight, the waiting time can be used to try to make your weight to come to that normal range, as close as possible to normal range. Not too little and not too much. If you can have your transplant under such conditions, your prognosis will be much better. If you come to transplant with excessive body weight or with too little body weight, the transplant can still be done, but you must know that your risk will be much higher. So the ideal scenario, the scenario that you should strive for if you want to have the best possible prognosis, is to try to achieve a body mass index between 20 and 25. If you are higher than 25, you're already overweight. If you are higher than 30, you are obese, and therefore we will not even call you for transplant. If you have body mass index of less than 19, you will be undernourished, and we will need to improve your nutrition. If you get to 17 or lower, we will not do your transplant. So during this waiting time, you will have the support of the cardiopulmonary rehab program and the nutritionist team that we will try to do all possible to bring your weight to the closest possible to normal. Also, despite your lung condition, we will enroll you to a cardiopulmonary rehab program because despite your breathing limitations, the more fit you can be, the more conditioned you can be, the better muscle mass that you can accumulate during the waiting time, the better your outcome would be. A lot of patients will think that because they have hard time breathing, they cannot do rehab, and that is not true. We have a very experienced team of respiratory therapists and exercise therapists that we will help you to become as conditioned as you can be despite your lung disease. Some of our patients will have progression of the disease while they are waiting, particularly because there is a relative lack of donors compared to the abundant number of patients waiting for lung transplantation. And in many cases, the lung condition will progress to the point that patients may require too much oxygen to be at home and they need to be admitted to the hospital. And in extreme conditions, patients may even need to be put on a mechanical ventilator prior transplantation. Even then, even if this happens, we will try to help you to get through this process. 30% of the patients with transplant, by the time they receive the donor, they are already admitted in the ICU, they are already connected to a ventilator, and typically they will have a tube in their neck to help them breathe. This is called a tracheostomy tube. And the idea is that despite the need of this level of respiratory care, you should still be able to stand up, walk, and remain mobile. As long as you remain mobile, your transplant can be done. Once you get to a point that your lung condition does not allow you to get out of bed and move, then the window of opportunity narrows dramatically. How about the day of potential transplant? What is going to happen? Well, this is the process. As I mentioned before, the organ procurement organization will inform us that there is a donor available for you. The physician, the lung transplant physician receiving this information will be given clinical history from the donor, medical social history of the donor, and an array of pertinent laboratory and radiographs, and also results from a bronchoscopic study done on the donor. Based on all this information, the lung transplant physician will decide if this donor is good enough for your case. If we do accept the donor, you will be called. That means you have to be available at all times. Your phones have to be open. Your lines have to be available at all times. That means at nighttime you don't want to put your phones on a voicemail system, because we have had patients that have done that, and next morning they realized that the previous night there was a donor available for them, but we could not reach them. If we cannot reach you when we have an offer for a potential transplant, we will give that lung to somebody else. So you have to make sure that your phones are open at all times. When we call you, we will have to bring you to the hospital even before we know for sure that the donor is completely well, because when we accept a donor on your behalf, that gives us finally the right to go and assess the donor. But in the meantime, we will be accepting the donor based on the information we are given alone. So you will be admitted to the lung transplant center. You will be prepared for the potential lung transplant, while our team has the opportunity to travel and actually examine the donor. The donor will be taken to the OR, and when our surgeon can visualize the organs, in this case the lungs, if they are healthy, at that point in time, that's when your case will finally be moved to the OR, but not before. If the donor is found to be not suitable because any unforeseeable fact is found that contraindicates lung transplant, then the process will be called off and you will be discharged from the hospital. This is what lung transplant patients know as a dry run, meaning you went through the whole process, you were ready for your transplant, but at the end it could not happen. If the donor is found indeed viable, if the lung is found to be healthy and our surgeon is convinced that we can use it for your transplant, then you will be moved to the OR, you will be placed under general anesthesia, and your surgery will be started. So this is the whole process that goes from evaluation until the day of your transplant. Thank you.
Hello, I'm Margie Wright, Lead Coordinator for the Lung Transplant Department at Mayo Clinic, Florida. I'm here today to explain to you the role of the nurse coordinator as it pertains to the lung transplant evaluation at our clinic. Before we get started, I'd like to introduce the rest of the staff. There are 4 nurse coordinators in our department. There's myself, Alvin Giardo, Marcy Landucci, and Kelly Norman. All of our nurses are registered nurses certified in transplant. In addition to the coordinators, we have 2 administrative assistants, Tiffany LaRosa and Sarah McLeroy. Julie McCarthy is the physician's medical secretary. Our clinic hours of operation are Monday through Friday, 8 a.m. to 5 p.m. Please be aware, phone messages left during these hours will be returned by your coordinator or administrative assistant in the order of urgency. Please leave a detailed message and realize that calls received after 2 p.m. may be returned the following business day. The role of the transplant nurse coordinator is to facilitate the transplant process. All of the registered nurses in our lung transplant clinic are certified clinical transplant coordinators. Your nurse coordinator will be a consistent presence throughout your pre-transplant experience. This diagram illustrates how you and your coordinator will work together as a team. I can't emphasize enough the importance of timely and effective communication between you and your coordinator. Your coordinator will help educate and prepare you for transplant and is your advocate. He or she will work to identify your needs and collaborates with other members of the transplant team to meet mutual goals. Now that we've identified the relationship between you and your nurse coordinator, let's take a look at the steps for lung transplant evaluation. The first step is the referral. That's already been done, and that's how you got here to us. The next step will be your initial clinic visit, followed by the evaluation. Once the evaluation is complete, you'll have a wrap visit, and then your case will be taken to selection. If deemed a suitable candidate for transplant, the next step would be listing and then clinic follow-up visits. Your initial clinic visit will include appointments with the physician and the RN. During this time, the coordinator will verify demographic information and obtain additional health history as needed. He or she will explain the importance of a healthy body mass index, a reliable caregiver, and the lung allocation score. The evaluation process takes approximately 10 to 14 days. This will vary according to your age, medical history, and previous test results. During this time, you'll undergo extensive diagnostic testing and evaluation with many disciplines, such as social work, psychiatry, and nutrition. This will include assessment of your weight and fitness level to determine your body mass index. You'll undergo comprehensive screening to identify exposures to nicotine and cotinine. Cotinine is the byproduct of nicotine and can be detected even after the nicotine has cleared your system. You should avoid all nicotine products. This includes gum, nicotine patch, any type of tobacco, e-cigarettes, and secondhand smoke. You're not a candidate for lung transplant if nicotine or cotinine are detected in your system. You will also be screened for drugs of abuse. An important aspect of lung transplant is identifying environmental risks. These are factors that can or have already contributed to your lung disease or can cause irritation and damage to your new lungs. Some examples are mold, mildew, chemicals, and dust. We like to prepare people that some animals and animal-related activities need to be avoided post-transplant. After transplant, you cannot have birds or rodents, which means gerbils, guinea pigs, etc. And you cannot have contact with animal waste. Prior to transplant, all immunizations must be up to date. You'll meet with the infectious disease doctor to determine if any vaccinations are needed. If so, you'll be given a prescription for required immunizations. Another important aspect of your health that we'll need to pay close attention to is your nutritional status. Let's talk a bit more about the body mass index. The BMI is an assessment of your health risk. It's calculated using your height and weight, and the more out of range your BMI, the higher your risk. An acceptable BMI is between 18 and 30, with anything 17 or less being underweight and anything greater than 25 being overweight. The ideal body mass index is 25 and puts you at the lowest risk. Once your evaluation is complete, you'll meet with the nurse coordinator and the physician to review the results. This is what we call a wrap visit. The next step is taking your case to selection. The selection team meets weekly and will review your evaluation to determine your candidacy for transplant. There are 3 possible outcomes from selection. You can be accepted, denied, or deferred. Your nurse coordinator will notify you of the decision made by the transplant team. Your coordinator will enter your information into the UNOS database, which in turn will calculate your lung allocation score. The score ranges from 0 to 100, and urgency for transplant is indicated by your LAS. The higher the LAS, the more imminent. There are many variables that will determine the LAS, including your diagnosis, your age, labs, and test results. Once listed, you'll be seen in the clinic every 3 months and as needed. Your score will be updated with your latest test results each time you're seen in clinic. It's important to remember that your ranking changes continuously as potential transplant recipients are added to and removed from the list. If you're deemed a suitable candidate, you'll be listed with the United Network of Organ Sharing once financial clearance is obtained. This can take anywhere from 24 hours to 14 business days, depending on the insurance company. UNOS is a nonprofit corporation responsible for organizing organ donation, procurement, and distribution on a national scale. They're responsible for managing the national computer-based wait list of patients awaiting organ transplantation and for making donor offers to compatible patients based on medical urgency. It's important to know that donor offers are made by UNOS, not the transplant center. The offers are accepted or declined by the lung transplant physician. You may be asking yourself how they choose who gets the offer. UNOS identifies the potential recipient based on a match in blood type, height, and LAS. What you must keep in mind is that there are multiple competing transplant centers in our region, so it's possible to have multiple recipients with similar data. A term you should be familiar with is a dry run. This is a situation where a donor becomes available and the recipient is called to the transplant center for surgery, but the transplant gets canceled. The most common reason for a dry run is due to unexpected donor findings. In conclusion, I'd like to revisit a few key points. Make sure you optimize your health by adhering to a healthy diet and exercise plan as outlined for you, and take all medications as instructed. Contact your coordinator if an outside provider prescribes a medication for you. Remember, communication is vital. Please notify your coordinator before traveling. We need to know if you are acutely ill and/or hospitalized, particularly once you've been listed. Your coordinator may need to temporarily inactivate you from the transplant list if you're traveling outside the area or you become hospitalized. This will depend on the distance from the transplant center and the severity of your illness. If hospitalized, make sure to inform your physician that you're listed for transplant at the Mayo Clinic. Once you're listed, you should be prepared to come in at any time. Pack a hospital bag and have it available. Keep all cell phones charged and in the on position, and provide alternate phone numbers to your coordinator, and do not leave your phones on automatic voicemail mode. Thank you.
Hello, my name is Adriana Vasquez. I'm in the Department of Psychiatry here at Mayo Clinic, Florida, and I've been here in the department for the last 14 years. I've been working in transplantation psychiatry for the last 15 years. I got interested in this field during my fellowship in psychosomatic medicine. And it's an honor for me to talk to you about transplantation psychiatry and how can we help you during this process, not only to you, but also to your family. Why am I coming to psychiatry? How psychiatry and your transplant team collaborate? We do this through a mental health care team, and this team is composed of different providers. We have psychiatrists and nurse practitioners, registered nurses, psychologists, and a psychotherapist that will help you through this process. These are the psychiatrists that you may get to see during the journey of transplantation. Doctors Romans and Niasi are very likely to be involved in your pre-transplant assessment, but you may also get to know Drs. McMaster and Dr. Richardson. Our nurses, Debbie and Jennifer, are there to help you and your family as well. They help us maintain an open communication as we move forward with the process. You may also get to know them during the first visit. Mr. Orski is our psychotherapist. He's very knowledgeable about what life is after undergoing a long transplant. And Rebecca is our nurse practitioner that helps us with medication management. Dr. Tanis Furman has been very involved from the psychology group in helping us understand more about your cognitive abilities. So you may get to see her or one of her colleagues if you get scheduled for neuropsychological testing that will help us understand better how your brain is processing information. What's our role in psychiatry? We'll do a pre-transplant psychiatric evaluation that will help us understand better where you're starting in the process of transplantation and get us prepared for how we're going to be dealing with potential complications after the surgery. We offer emotional support. We can also help you improve coping skills through therapy, and we may use medication if needed. There are a lot of different emotions during the process of transplantation, when you're waiting for your transplant or after you've had your surgery. You may be asking yourself, am I going to be listed? Am I going to die? There are also a lot of unknowns. How is life going to be like after transplantation? What about all the different lifestyle changes? We also keep a very close eye on symptoms of depression, as this is likely to interfere with your recovery after the transplant, and if left untreated, will also interfere with your survival and quality of life. So we keep a very close eye on feelings of sadness, hopelessness, helplessness, suicidal thinking, and we'll like for you and your loved ones to keep us informed of any changes in your emotional well-being before or after the transplant. So we'll work on providing you with the tools to help you cope during this period of time with all these different emotions and also with lifestyle changes that will come along after the surgery as you become a transplant patient. Relationships are key. You'll be entering a long-term relationship with the transplant team, and it'll be very important also for you to stay connected with the people important in your life, especially your caregivers that are likely to help you with this process. We do not want to see any smoking after transplantation. This will kill you. So if you experience any thoughts of smoking or using any tobacco products, please reach out to any of us in the transplant service, any of us in the Department of Psychiatry. There are medications that are approved for smoking cessation, and behavioral counseling is also to be of benefit. Some of these symptoms can get so overwhelming that medications may be needed. So during the process, we'll explain to you what these medications do and certainly help you following your progress on all these different medications and treatment interventions that we recommend. Thank you very much for your attention.
Hello, my name is Lindsay Hartley, and I'm the Heart and Lung Transplant Financial Coordinator at Mayo Clinic. Today I'm going to discuss insurance and how it relates to transplant. The cost of an organ transplant is usually beyond the financial means of most patients and their families. Thus, medical insurance is necessary in order for patients to cover the expenses associated with these life-giving procedures. For example, the transplant evaluation and workup on an outpatient basis can cost approximately $55,000. The hospitalization for a lung transplantation costs approximately $300,000, and the post-transplant care costs approximately $55,000. Keeping in mind these are estimates only and the cost of actual services can vary greatly. As a transplant financial coordinator, my role on the transplant team is to simplify the insurance process. Before the evaluation process, I will verify both transplant and non-transplant benefits. Throughout the process, I will obtain the necessary authorizations and approvals for exams and services. And if applicable, I will keep your case manager updated regarding your status. As the patient, it is crucial to remember you are responsible for promptly communicating any and all insurance changes. Changes in your insurance can affect where you will have transplant benefits. The terms and benefits of your insurance can vary widely. You will need to take an active role in understanding your particular coverage. Few patients are able to pay for all costs related to transplant through a single source. Therefore, it is important for you to educate yourself about different types of insurance and resources that may be available or that you are eligible for, such as disability and Social Security, Medicare and Medicaid, health insurance, COBRA, and external organizations. Some important things you will need to learn about your insurance include, but certainly are not limited to, whether Mayo Clinic accepts your insurance, the difference between transplant and non-transplant benefits. This can impact both where you receive transplant and follow-up care, how much you should be expected to pay, whether transplant is a covered benefit under your plan based on your diagnosis, and whether your insurance policy has a lifetime maximum both for transplant and non-transplant services. Please keep in mind, if you change jobs, you usually cannot take your old insurance with you. COBRA is one exception to this rule. Your new employer may not offer insurance at all, or your insurance coverage may not start immediately. Keep in mind it is very important for you to try to avoid lapses or gaps in coverage. Together, you and your transplant financial coordinator will determine your benefits. Take advantage of this resource. Keep them updated regarding your insurance. Communicate any questions or concerns you have. Insurance can be difficult to understand and even to obtain for some transplant patients, but don't give up. There's a better answer out there.
Hello, I'm Elizabeth Mann, the lung transplant social worker at Mayo Clinic, Jacksonville. As part of your transplant team, my role as a social worker is to assess and reassess your psychosocial needs, assist with caregiving issues, advocate on your behalf with medication and financial needs, as well as help you adjust to a new lifestyle. One of my roles as a transplant social worker is to help our patients develop a transplant plan. The areas we look at are the following: relocation, caregiver and backup caregiver, selection of and registration with a specialty pharmacy, your insurance coverage and medication costs, your cardiopulmonary rehab benefits, and your advance directives. The first area we look at is relocation. If you do not reside in the Jacksonville area, you will be required to relocate, sometimes even as you await a transplant. Your stay in town for transplant relocation is unknown, but could be up to 1 year. Following your transplant, you will be required to stay in Jacksonville for a minimum of 3 months. Close proximity to our center expedites access to donors and urgent care. One of the relocation options is the Gabriel House of Care located on Mayo's West Campus. This is a communal living facility with 29 rooms, requires a social worker's referral. A caregiver presence is required. You may want to check for availability. Please do not bring small children, and no smoking is allowed on campus. This facility operates on a first-come, first-served basis, so please have a backup plan available in case there is no availability. Shuttle services are available, but we would prefer you bring your personal transportation to town. Other relocation options are short-term lease of local apartments, condos, houses, and hotel suites. If you have an RV, you may also consider using it for relocation purposes. Staying with relatives in town is another option as well. As you look at relocation costs, with typical average cost of $2,000 per month, factoring in rent, food, and gas, you will need to determine how you will manage financially paying for 2 households, your home residence and your temporary residence here in Jacksonville. Since some insurance carriers include a relocation benefit, this is something you may want to research. How is this relocation benefit accessible? Via insurance debit card or reimbursement? If you bring an RV into town, please research the campground fees and how affordable they are. Another issue we look at is your caregiver plan. Your caregiver must be available to you for a minimum of 3 months, 24 hours a day, 7 days a week, depending on your medical needs. The transplant team may require that your caregiver be available to you prior to your transplant as well. If your caregiver works, please ask yourself if missing work would put his employment in jeopardy. Can your caregiver afford managing household expenses without work income? Is your caregiver eligible for time off under the Family Medical Leave Act? And if so, can he afford lack of income for the duration? A backup caregiver is also required, and caregiver duties can be shared by more than one person, as long as all your caregivers attend all required educational sessions and are well informed of the duties involved. The caregiver duties include around-the-clock monitoring of your condition, assistance with your medication regimen, transporting you to clinic at least 3 times per week, and providing emotional support. It is also very important that your caregiver maintains thorough and timely communication with your transplant team. Another part of your transplant plan is medications. Lung transplant medications can cost between $4,000 to $7,000 a month if you do not have insurance medication coverage. You will need to research the extent to which your insurance covers these medications, the costs of your copays, and how you will afford these expenses since these medications are lifelong. You can't skip or stretch a dose of these medications to cut costs. Remember, you will need a long-term plan to pay for these expenses as they do not go away. A complex and frequently changing medication regimen post-transplant requires that you choose a specialty pharmacy which is capable of providing you medications in a timely and consistent manner. Please research which specialty pharmacy is in network with your insurance and pre-register in order to be prepared. Maintaining your health insurance is very important. Please alert your transplant financial coordinator of any changes to your coverage immediately. Possible changes to your health insurance may relate to your disability status, transitioning to COBRA, or becoming eligible for Medicare. If you have an employer-sponsored plan or COBRA which requires monthly premiums out of pocket, please assess how you and your family will afford them. If Medicare is your primary insurance, it will pay for 80% of your immunosuppressant medications, and a Medicare supplement will cover the remaining 20%. Medicare Part D is your non-immunosuppressant drug coverage. Please assess your financial ability to pay for the annual Medicare donut hole, the cost of your supplemental insurance, and your medication copays. Given a patient's financial resources, fundraising initiatives may be necessary. National fundraising organizations such as Help Hope Live, the National Foundation for Transplants, and Give Forward can help you and your family raise funds needed for cost of relocation, medication copays, insurance premiums, as well as fees for cardiopulmonary rehab otherwise not covered. Additionally, funds may be needed to cover the loss of income for a caregiver on FMLA. Cardiopulmonary rehab is required pre and post-transplant in order to maintain and reestablish conditioning. Therefore, please determine your insurance-based rehab benefits, number of sessions covered annually, and out-of-pocket costs. Lastly, please consider completing a set of advance directives consisting of a living will and designation of healthcare surrogacy, and forward these documents to your social worker. In order to provide you and your caregiver with adequate lung transplant knowledge, participation is required in the lung education class and the transplant caregiver class. Our lung transplant support group meets weekly, and I encourage you to attend for support and monthly education opportunities. Post-transplant, you are required to attend follow-up clinic visits. Please observe precautionary measures, continue taking your medications regularly, and maintain a healthy lifestyle. Lifelong communication with your team will remain of utmost importance. Hearing all this information may feel overwhelming to you. The mountain may seem too high to climb. However, as you complete each step, it will become easier and more manageable. As you embark on this transplant journey, you are not alone. As a patient once said, we all walk in each other's footsteps.
Hi, I'm Dr. Michael Shue. I'm a pharmacist, and I'd like to speak with you a little bit about pharmacy and lung transplant. My role is to guide, prepare, educate, and assist you with your medications after your transplant. First, I'd like to speak a little bit about your immune system. The role of your immune system is to attack foreign objects, foreign targets, things such as bacteria, viruses, fungi. Your immune system helps keep you healthy. It keeps you from getting sick. It does a lot of really, really good things for you. However, when you take an organ from one person and put it in another person, the immune system recognizes that as being foreign, tries to attack the new organ, and tries to destroy it. So when you have an organ transplant, it's important to suppress your immune system with anti-rejection medications so that your immune system does not destroy the organ. The problem that you have with suppressing your immune system is that it leaves you open to attack and leaves you open to infection by bacteria, viruses, and fungi that your immune system normally protects you from. So it's really a balancing act between suppressing your immune system and keeping you from getting infected from maybe life-threatening illnesses. There are a lot of medications that you might be after the transplant. Usually you're going to be on 3 anti-rejection medications, and you might ask, why am I going to be taking 3 anti-rejection medications when maybe I can take 1? By taking 3, your immune system is further suppressed. You get a synergistic effect where you get maybe a 1 + 1 = 3 type of effect from these medications, where if they work by different mechanisms of action, in other words, they work different ways, they can keep your immune system from circumventing the drugs, and they can cut it off at the pass, keep those medications. Those medications will keep your immune system better in check. You can use lower doses of these medications, so you get a lot less side effects. So you get less side effects, you get a lot better efficacy by using more than one medication. You'll usually be on 1 antiviral, 1 antifungal, 1 antibacterial, maybe some supplements, some dietary supplements, anti-ulcer medications, blood pressure medications, and insulin. Now, you may or may not be on insulin after the transplant. If you're diabetic before the transplant, you're more than likely going to be diabetic after the transplant. These medications, the anti-rejection medications, sometimes will cause people to be diabetic after the transplant. And you may also be on other medications here at the bottom. So how long will I be on anti-rejection medications? Lifelong. You're going to be on them forever because you have to keep your immune system in check from rejecting the organ. Many medications, maybe some of the antibiotics have a specific duration, or other medications, there may be a certain period of time that you take them, but it depends on how you're doing, on how long you're going to be on some of these medications, and some of them you're going to have to be on them a certain period of time because of protocols where they found out that by being on certain medications for a certain period of time, patients do much, much better. All medications have side effects. These medications have multiple side effects. You're not going to get all of them, but if you notice that you're having a side effect or something is not right, please inform your healthcare professional, and those things can usually be handled. Sometimes it just takes changing a dose of a medication. Sometimes it changes changing the time of the dose. You can take care of this, or you can be treated with another medication to help with these side effects that you might get. This is a complex process. Transplant is very complex. It takes a lot of preparation. You'll have to prepare to find a pharmacy. It takes hard work. It takes practice. It takes a lot of preparation ahead of time to find a pharmacy, to be organized in taking the medications, also know how you're going to pay for the medications. So selecting a pharmacy, you're going to be using a specialty pharmacy that specializes just in transplant medications. You want to find from your insurance company what pharmacies are in network. These pharmacies that are specialty pharmacies should have these drugs all the time. Your average neighborhood pharmacy will not. That's why you'll have to use a specialty pharmacy. You also not only want to find a pharmacy that's in network, you want to find a pharmacy that's going to be convenient for you. You want to find a pharmacy usually that can service you overnight if you have medication dose changes. You want to deal with a pharmacy that has experienced staff in transplant. Most healthcare professionals, most pharmacy personnel, any healthcare professional does not know much about transplant medications and transplant. They don't realize that you cannot vary the timing of your doses. You cannot be missing any doses. Many have to do your homework ahead of time to find an in-network pharmacy. It may be a mail order. Sometimes they're going to send you your medications for 3 months at a time. Transplant medication costs. Even with insurance coverage, some of these medications are so expensive you're still going to incur substantial costs to pay for your medications. So the folks that can help you with the costs are financial coordinators, social workers, and pharmacists. They can help you determine what your out-of-pocket cost is, but you can also find out this information from your insurance company because they're the ones who really dictate to you what you're really going to pay. What you want to do as well is you want to plan ahead of time for what your copays are going to be, and you want to save enough money for 1 year's worth of drug, whatever your out-of-pocket costs are going to be, say per month for these medications, or for 3 months if you're going to get 3 months at a time. Since you're going to be taking 10 or 12 new medications, you're going to be taking them at different times of the day, you want to really use a pill box and use this pill box to help you stay organized along with your caregiver. You also want to understand that some of these medications may have to be taken with food or without food. Sometimes you have to avoid certain things in your diet so that they do not interact with your medications. So a medication organizer is a really good idea. Also, your pharmacist or your other healthcare professionals can help you with drug interactions or foods to avoid. We also remember you're part of the team. Those patients who are most involved with their care, most involved with taking their medications, that know the most about their medications, do much, much better. Thank you so much for your time.
Hello, my name is Tina Bost. I am the outpatient dietitian for Transplant Services. Our inpatient dietitian for Transplant Services is Sonia Urardo. I'm here to talk to you about healthy eating for life during the whole process of transplantation. Why is nutrition therapy important in transplant? During your pre-transplant evaluation, you will be scheduled to see a dietitian for a nutritional assessment and given guidelines for appropriate diet. Studies have shown that patients who go into surgery appropriately nourished tend to have better outcomes, less infection, shorter hospital stay, and an overall quicker, easier recovery. It is extremely important to achieve and maintain a healthy weight throughout all phases of transplant, before transplant as well as afterwards. A healthy weight is defined as having a BMI, body mass index, between 19 and 25. You must have a body mass index less than 30 to meet the weight criteria for transplant. You should strive for that ideal body weight for better prognosis. Remember that extra weight stresses bones and joints that are weak and could increase your risk for heart disease, high blood pressure, and diabetes. If you are underweight, body mass index less than 19, our goal for you is to regain weight, muscle, and fat until you have reached a healthy weight. It is important to live a healthy lifestyle now, before transplant, and making it a lifelong commitment by achieving and maintaining healthy eating habits and engaging in regular daily exercise. It is also important to get the family and or caregiver involved in healthy eating for additional support. We encourage you to follow the Mediterranean eating approach. As you see, it is focused on more plant-based, calorie-controlled diet. It consists of a variety of whole grains, including plant-based proteins, beans, nuts, and legumes, a generous amount of vegetables and fruit, choosing heart-healthy fats such as olive and canola oil, and avocado in moderation. Non-fat, low-fat dairy products daily for adequate calcium intake. When looking at the animal sources of protein, primarily choosing fish and poultry breasts, pork loin, while cutting back on the intake of red meat. And at the peak of the pyramid, it consists of sweets, sugar intake, which we want to limit. It is also important to limit the intake of all fried, processed, and high sodium containing foods. What to expect immediately after post-transplantation in the hospital. Your diet is likely to advance shortly after surgery. You may not be hungry for a heavy meal or be able to eat a usual amount, but try to order 3 meals and eat what you can. By the way, do not wait for someone to take your order or meals to appear. Our patients order the meals through room service by telephone. You will see a dietitian within a day or 2 of your surgery. Please let us know if you have a poor appetite or for any reason have trouble eating. It is important to consume an adequate amount of calories and protein after transplantation. Some patients have problems with high blood sugar after transplant, even if they didn't have diabetes prior to transplant due to the steroids. If you already have diabetes, it may exacerbate by steroids. If this happens to you, we can work together to help improve your blood sugars, which will aid in wound healing and reduce infection and rejection risk. If insulin is required, the best diet modification you can make is to avoid the intake of carbohydrate snacks between meals. You can choose non-carbohydrate snacks, such as vegetables or protein, between your meals. Food safety is an important component after transplantation. You will be taking immunosuppressive drugs for the rest of your life. With a compromised immune system, you are at greater risk for coming down with a foodborne infection, which can be serious or even fatal. Therefore, it's extremely important to follow these safe food handling practices. While shopping for foods, you want to purchase the cold items last. Store these perishable items as soon as possible. You want to make sure the food is not passed by the sell-by date, so looking at those food labels is very important. Buy only pasteurized dairy products. Once you get home, you want to make sure you wash the fruits and vegetables under running water for at least 1 to 2 minutes. You want to thaw out those frozen foods properly. Cook meat to the appropriate internal temperatures. Avoid cross-contamination by using different cutting boards and knives for meat and vegetables. You also want to make sure to store your leftovers properly. There are 3 ways to safely thaw or defrost your food. The first way is overnight in the refrigerator. You want to make sure that the juices from the meat do not drip onto the other foods. So therefore, the best place to put it is on the bottom shelf. Second way to defrost is using the microwave defrost thaw cycle. You want to make sure to cook immediately afterwards, though. The third way is by using cold running water. By placing the food in a waterproof plastic bag and submerging it in running cold water, just make sure not to leave that food item in the cold running water the whole day. Cooking food directly from the freezer is also a safe way to defrost or cook your meals. Never thaw food at room temperature, such as on the countertop. Foods are safely cooked when they are heated to the USDA FDA recommended safe minimal internal temperatures. To ensure that your foods are cooked safely, you should use a food thermometer to measure the internal temperature. You should cook your beef, pork, veal, lamb, steaks, roasts, and chops to at least 145 degrees Fahrenheit and holding it for 3 minutes of rest time after removal from the heat source. You should cook the fish to at least 145 degrees. You should cook the ground meat to at least 160 degrees Fahrenheit. All egg dishes need to be cooked to at least 160 degrees Fahrenheit. All your poultry, including whole poultry pieces, ground poultry, needs to be cooked to that internal temperature of 165 degrees Fahrenheit. All leftovers need to be reheated to 165 degrees Fahrenheit. Reheat sealed lunch and deli meats until they are steaming hot or 165 degrees Fahrenheit. Never eat the cold cuts cold. When eating out, you want to try to avoid all salad bar, buffet style restaurants. The best thing to order is hot foods only. Cook to order items are the safest. Avoid all raw, undercooked meats or fish, including undercooked steak, sushi, ahi tuna, ceviche, raw oysters. You want to choose hot sandwiches only. A good resource to review is the USDA FDA Food Safety for Transplant Recipients booklet, which you will see the website included. There are several known permanent food restrictions after transplantation due to the interference with medications you will be on lifelong. You want to avoid all grapefruit and grapefruit products, all lime and lime products. All other citrus are going to be okay, including lemon. Sour Seville oranges, such as orange marmalade, needs to be avoided. Pomegranate, all pomegranate products need to be avoided. This, again, is a permanent restriction since you will be on these medications lifelong. The aim of long-term medical nutrition therapy is maintenance of a healthy weight and prevention of nutrition problems. There are several post-transplant nutrition concerns. The first most important is obesity. We want to make sure that you do not gain weight after transplantation, therefore increasing the risk of other chronic diseases such as heart disease, hypertension, diabetes, and osteoporosis. It is important to prevent obesity. When it comes to maintaining a healthy weight for lifetime, the bottom line is calories count. Weight management is all about balance. Balancing the number of calories you consume with the number of calories your body uses or burns off. Caloric balance is like a scale. To remain in balance and maintain your body weight, the calories consumed from the foods we eat must be balanced by the calories used in normal body functions, such as daily activities and exercise. Therefore, the prevention of obesity is eating less and exercising more. There are many factors that affect the success and outcome of transplantation. Some are uncontrollable and unpredictable. Some things, however, you can control, like the foods you choose to eat. And remember, don't give up. There is help. And thank you. Have a great day.